The Michigan Department of Health and Human Services recently released this report citing that the Legionnaires outbreak in Flint and Genesee County wasn't caused from the Flint water switch, but rather it leads them in the direction of McLaren Flint Hospital. The state of Michigan today saying Flint's water crisis in all likelihood was not the cause of a massive Legionnaires outbreak that killed 12 people between 2014 and 2015. The state says it compiled data to track where the illness was coming from before and after the water switch in Flint. They say leading up to the outbreaks, the rate of Legionnaires cases had already increased substantially nationwide by 286% from 2000 to 2014. But most notably in the report from the state, officials say that there was only one common source of Legionnaires, and that was McLaren Flint Hospital. The state says 65% of the Legionnaires patients had hospital building exposure, and of that number, 94% were at McLaren Flint Hospital. There were 32 cases who did not have exposure to McLaren Flint, but only 9 of them lived on Flint water. The state says the number of cases was actually higher for people not living on Flint's water system. Now, this all comes as the head of the Michigan Health Department and the state's chief medical officer are facing trial on charges relating to a Legionnaires-related death in Flint. Now, we have reached out to McLaren Hospital and they have issued this statement saying in part that they find the timing of the state's release today to be interesting. A coincidence as the first phase of the criminal proceedings against the MDHHS leadership winds down. Initial review of the report reveals no new information regarding our community's epidemic of Legionnaire's disease in 2014 and 2015, but reflects the state's normal pattern of attempting to shift liability away from those criminally charged. And of course, we'll keep following this developing story for you. In Flint, Rachel McCrary, WNEM TV5.